Hi, everybody. Welcome to the Burnout Podcast. My name is Skip-O, and I'd like to talk to you about our sponsor today, Throttle and Thrive. Throttle and Thrive is a 6-bed facility in California. It's a men's substance misuse facility exclusively serving first responders and veterans. Throttle and Thrive can be reached at 805-701-1309. 805-701-1309. When you make that call, Siobhan Thompson will probably be the one answering. She's the CEO there. And then she'll ask you some questions. And then after you decided you want to change your life and you want to live life, she will personally come and pick you up at the airport once you fly out anywhere from the United States. So keep them in mind if you're out there or a family member's out there and they need some help, whether it's for addiction, mental health, or whatever the case may be. Please go to throttleandthrive.com. Check them out for more information. Thank you. Dr. Ann Goode, she is with us. And doctor, where are you from? And tell us a little bit about yourself.
Hi, Skip-O and everybody out there. I am really happy to be with you. I am now living in Anaheim, California, so Southern California, Orange County. I work with first responders in Orange County and Los Angeles County. I have been doing this work particularly for about 3 years now. I've been a therapist for 14 years and got my clinical psychology doctorate 2 years ago. So a very busy time. I also work with general public, but about 70% of my clientele now is just first responders and military, and love working with the population.
Well, we love that you're doing the job you do. It's not, I tell you what, us first responders, fire, police, military, we can be a little bit stubborn. And it's like pulling teeth, trying to get information from us. So we applaud your patience and tolerance for us.
Oh, well, thank you. I really enjoy the dedication and discipline and all of the history coming in with each person that I work with, because although they may work within the same department or the same field, whether it's law enforcement, fire, medicine, military, you know, a lot of the same training for those niches, but you know, they all come in with different life stories.
I tell you, I get to interview people, and then I talk to a lot of different people around the United States and hear the stories that they went through. You know, not just being a first responder, but, you know, pre-first responder. You know, a lot of people's had a tough life, and then they get into that job because of their past.
Yes.
And then they bring some baggage from their past into there. Then you add stuff to it, you know, going on those runs or those calls or going to a mission or whatever. And then you're trying to fight off those demons between your ears. And it just gets too overwhelming, where we need people like yourself, you know, the old saying, rescue the rescuer, come in and do your thing. So, you know, I talked to a lot of different therapists and a lot of different people that help first responders. And you got, what I noticed, you guys got, you're amazing. You got a heart of gold. And we just, again, and I'm going to, you know, I just really appreciate you and for what you do in your job. But as you know, with life changes, not just for first responders, for people, and changes for therapists, doctors, and people that help us. So do you want to tell people about what's changing about your life here in the last 6 months?
Oh, geez. Well, let's see. I have gone from one first responder treatment center in LA County. I helped them to start up. And then I was coerced by a wonderful woman named Vaughn, who is an ambassador for first responders in California. And I will give her number at the end of this too, if anybody needs to reach out and get some additional help. But she said to me after a tour of the facility, hey, if you want to come over, just just let me know. So I actually did that. And then I went to another facility in Costa Mesa. Unfortunately, they are closing the first responder program down. So now I'm going to be doing some consulting work with another facility, but I do private practice, and I also work for a company called Premier First Responder Psychological Services, and Heather Williams, and I'll give her number out at the end of this podcast also. So I'm kind of all over the place. I am going to be taking my retest for my psychological licensing exam in October. I took it once, didn't pass it, but only 30% of people who take it the first time do pass it, so I'm okay. I'm a licensed marriage and family therapist otherwise, and I've been working under that licensing. But it's been very, very busy. I think, fortunately, the word is getting out to a lot of departments now that there is help. If you need some additional help, going and getting treatment for PTSD, for alcohol abuse or misuse. Sometimes it's drugs, prescription drugs or non-prescription drugs. So it can be a gamut of things that people come in for. What I like to do is make everybody feel comfortable, not judge them. Just, sit down with me and tell me your stories. Offload it so that you're not feeling judged, you're not feeling alone, you're not feeling heavy with these stories, and understanding that there is help and there is treatment for everything that you're going through, and to keep moving forward and believe in yourself and trust other people that you're going to be better.
I talked to a first responder the other night here in my town, and, I never thought this person would reach out to me because I worked on the same department, and he reached out, and I was grateful that he did do that. But, one of the things he said, and I agree with him, the hardest thing is reaching out.
Yes.
For a lot of, and for me especially, I thought, man, I'm a failure. Man, I did all this, and it seems like the world's coming apart. When things are bad between the ears or in your heart or in your emotions. But, what I had to do is go back 4 years ago, go through a treatment facility for 43 days and get some help, because I never worked on those runs that we had for 30 years. I just thought, man, I'm sober, been sober for 20 years at the time, and never worked on that. And then I run into where those runs were hitting me, and I was like, man, I thought, here I am on the board for Indiana for American Foundation for Suicide Prevention. I facilitate suicide prevention groups. I do a lot for our community. And I was afraid, or I was embarrassed to reach out for help, because I'm supposed to be this, I wouldn't call a leader, a person of responsibility in our community. And here I couldn't stay above water. And I think a lot of that, doctor with first responders and therapists and doctors is like that too. Here we're supposed to be helping people, but here we're kind of we're sinking. Have you ever ran into that kind of feelings with certain people?
Yes, over and over and over again, especially, and thank you so much, Skip, for sharing. I really appreciate you, everything that you do. And you use the word failure, and I tell you, that is a common word. Very common. They feel like they're a failure, feel like they're weak. They're frustrated. And these are the words that they use over and over again, no matter who shows up at my door. And one of the things that I work with is changing those words, the power of words, especially failure. You think of how multi-layered that is, and it's going down to the core of your self-worth and your self-esteem, and not looking at what have you done in your life? What have you accomplished? How many people have you saved? How many people's lives have you affected? In the worst days of their lives, there you are. And the incredible power of that, but it's also a very heavy responsibility sometimes. And being able to look at the totality of your whole life and go, wow, you know what? I did really well here. And sometimes things didn't go so well on this call. You know, maybe I walked away with some shame or some guilt or, you know, a moral injury, something that just stuck with me and I can't seem to shake it. That's the type of material that I want to get into so that we can talk about it. We can release it through EMDR or somatic work. We can get into that, release that, let that go, so that you're not holding on to all of that baggage, because it can be just devastating year after year holding on to all of those stories so much, and you don't realize how much you're holding on to until you walk away.
Absolutely. You said that so well. When you get somebody like me or somebody, a first responder, and they feel like a failure, they feel their self-esteem is down in the hole when, you know, around them, everybody else thinks they're, you know, doing well. How do you get that first responder to think differently? How do you pivot from being a failure to having opportunities to grow or to be a survivor?
Well, first of all, I always like to go back to their childhood history and see if any of the messaging that they're going through now was pivoted back to their childhood, where the roots of this come in, because so many first responders came from really dysfunctional households. And they decided at one point, hey, I'm not going to go down the path that my other family members have gone down, and I'm going to go out and help people instead of hurt people. But, you know, it's, you know, going back to that messaging. Where did this start from? Who put this sort of messaging in your head? Let's go back. Maybe some internal family systems work, maybe some EMDR, going back and saying, oh, okay, this is where this all started, and this is where I need to pull this root of this weed out so that I can replace it with something healthier. And understand I'm not that person. Look at everything that I've done. You know, sometimes it is so hard and it takes some time. And a lot of times with my first responders, I have to go in there and do some really deep work really quick, especially if they're outpatient, because a lot of times if they're still working, then I need to make every appointment significant so that they get something out of it and they feel a little lighter with their psychic baggage when they leave.
Now, you said twice EMDR. A lot of people don't know what that stands for and what it does. Could you expand on that just for a little bit?
Sure. EMDR stands for eye movement desensitization and reprocessing. Yeah, that's a mouthful. It is it's one of the top trauma techniques that has been around since about 1990. What it does is it gets into traumatic memories and it releases them. It gets into people's subconscious areas. So when you're undergoing one of these sessions, the practitioner puts you into a state of semi-hypnosis, but it's not the hypnosis that we think of, you know, like the Hollywood version where, you know, I'm going to have you close your eyes and I'm going to have you walk down the hallway and open the doors. It's just to get your brain into this nice, relaxed state so that you're able to get into these memories that sometimes are just bubbling down in the surface in your midbrain. And then you get to talk about them. You don't talk about it like it's a regular story. You talk about these memories as if you're telling me about a dream or telling me about a movie. You're just letting your brain go into the here and now while you're processing out these memories. It has really done some incredible work with all of this EMDR. I've done this for like 8 years and I see people change really quick. The first session though can be pretty intense. So hopefully whoever you work with lets you know, just afterwards, you're going to be tired. You're going to probably not want to do a whole lot afterwards. And for about 24 to 48 hours afterwards, your brain is kind of processing through some things, and it can be a little bit tough, but it clears up just old memories really quick.
I tell you, when I first did it, they were telling me what they were going to do and kind of describing it. Of course, me, Mr. Critic and Doubter, oh, this ain't going to work for me. And then they did it. And I held the clickers or the things,
yes,
the clickers, and
that Theratappers, yeah.
We went through it, and it wasn't. The gentleman was doing it wasn't supposed to be the guy that was doing it, but he with me. There's another therapist I was with, but it just kind of worked out this worked out for us, and we sat down and did it. And then after I got done, like you said, it was very emotional. He was very good. A lot of you are good at what you're trained for, and it taking me through those hard times, and then making sure I had a safe place and bringing me back. And then afterwards I go, what just happened? He goes, well, Skip, we kind of know how it works, but we don't know exactly. We just know it works usually. So that's how.
Yeah.
And because he knew, I wasn't ready to hear the ins and outs and stuff, but it was something that helped me. And I did on multiple things along with brain spotting and some other, I did just got done with a study with neuro feedback. But when is somebody you think EMDR would work for? When do you, as a therapist, you're looking at somebody, you hear his or her story. When do you suggest that?
Well, after a traumatic event, your brain usually takes about 3 days to get back to at least somewhat of a normal state. So I would do EMDR on a critical incident, probably maybe a week after the incident up to about a month, because I want to grab it when it's in the acute stress stage and not let it go into PTSD. PTSD is if you go through a critical incident and you're holding on to it, and you're having flashbacks, you're having a hard time breathing and sleeping and eating. If you go through that for too long, after a month of the incident, it goes into becoming PTSD, and then it's a little bit harder to treat. But with the EMDR, I have gone back to childhood abuse issues and have been able to clear some of that out. And then it's amazing to see what happens with people afterwards, because we can have things happen in our childhood that can still affect us when we become adults, and we don't even realize it because we've been conditioned for so many years to, okay, this is normal. This is normal to have a bad relationship with my boyfriend or girlfriend or wife or husband, because that's the way my parents had it. But they don't realize you can change the narrative. You can get a lot of this traumatic baggage off of your brain and start making better choices. Because trauma makes us do horrible things and do horrible choices, because when we go back, anytime that we get triggered, and that's a big buzzword right now, right? I'm triggered, right? And a lot of people don't even realize what it really means. But triggering is you're going along your day, you hear a door slam, and all of a sudden it's like your brain's going, okay, I remember that happened when I had a really horrible argument with my dad. And then, it led into a physical abuse after that. Your brain goes back. There's parts of your brain that do not have a timeline. So when you get triggered, that part of your brain's going, oh, okay, it's this, and I'm going to do what's called abreaction. I'm going to act out not realize what I'm doing and be scary to people around me, or it's scary to myself, or this is so much I got to go and drink or drug or do some other type of addiction to get rid of this. And I don't understand where this is coming from. So many times I have first responders say, I don't know where this is coming from, but it's just really bothering me and it's wrecking my life right now. It's wrecking my home life. I can't function at work. I'm not sleeping. I mean, the biggest thing is sleep problems. This is what this all affects.
I tell you, you're spot on with everything. It sounds like you know what you're doing. But I remember one time, we got when I say small town compared to LA, we've got about 60,000 people in our town. Me and my wife was walking down a trail, and this is a few years ago, and I just started getting a little weirded out. And then I just started feeling funny. And then I remember we're walking by a river, and that's where we had somebody drown, and I had to go pull a person out. And that kind of, just as you described, that kind of made me feel uneasy and weird. And I've learned now to talk to my wife about it because I didn't want to before. You know, it was made me feel uncomfortable talking to anybody about it. But after getting help, I was able to talk to her. So, like, even in town, if I'm going somewhere, I worked in this town for 33 years. And you go by, like you're saying, you go by a house, you go eat in a restaurant, you're going to be reminded of stuff. I am reminded of this one road all the time. And now it don't send me into where it used to because I got coping skills now. But people out there, when they're talking about triggers, I'm sure they can relate with what you just said. And so they get triggered. And they went through EMDR, they get triggered. Now, you wouldn't suggest wait 30 years or 20 years to do EMDR. You're suggesting at least a week or two right after the traumatic event?
Right after a critical incident, yes. And because the whole thing is, it's, and I think what happens too is that, you can only take so much as a human being. It's like, day after day, call after call after call after year after year after year. And having that, well, I've got to be strong and I've got to suck this up and I got to push it down and I got to go and, escape somehow from this, but you get to the point in your body's going, that is enough. Usually it is some sort of critical health condition or a heart attack or a stroke or, trying to get to this material before that happens and to prevent that, hopefully. But it's just, it's all of these complex traumas on top of each other and being expected to be in this hero position. And I know, you guys hate hearing that word, hero. I don't like that. I don't like I'm put up on this pedestal and I've got all of this responsibility and I just want to be good at my job. That's it. And I want to come home safe at night and be with my family and hopefully have some good memories and some good times with my family and not fight and not bring those wars back home.
Absolutely.
You're going to be in war zone all the time otherwise. And that's a horrible way to live.
I tell you what, I think you know what you're talking about. I'm sitting there listening to you, and a lot of things that you describe was, not just me, but a lot of people that I've talked to and we can relate to. And one thing, what have you seen? We got EMDR, you got brain spotting, you got neurofeedback and talk therapy. What is some changes, other changes have you seen in helping, not just first responders, but in therapy, helping people through traumatic events? Is there anything around California, around here, that around the United States or around the world that you've seen that are breakthroughs?
Well, they're talking about deep brain stimulation, and I don't know much about that. I went to a trauma conference in Boston the first week of May, which was fascinating. It was some of the top neuroscientists at that conference, and they're talking about deep brain stimulation. So I'm going to be doing some more research on that. Okay. I think just the realization that this is going to take time to heal up. This is not a one and done, because I just talked to another therapist for Premier, and he does ART therapy. And that's something that I'm going to get trained in also, probably not until next year though. But, it's just realizing this is a process. This has taken years for you to get to this state, and having patience with that, but just the baby steps going forward, one step forward, two steps back sometimes, just realizing this. And then, having people on board that get you, that understand this is what you're going through versus this is who you're supposed to be. This is who you're supposed to be role modeling. This, and I hear a lot of wives, say this is not what I signed up for. And I had to sit there and go, what, we need to get you out of this illusion here. You've got a human being in front of you who has a really tough job. And thank God they signed up for it, because we're all safer because of this. But learning how to respect that and love, this is what you have got. Work through this. Don't sit there and say, hey, you're not living up to my expectations. Either way. And I go through that time and time again with the responders and their spouses. Expectations.
Sure.
Coming down and understanding, what illusions did you build up within this relationship, and you were disappointed. Let's talk about that and get through that and see how we can move you forward so that you're happier, because you deserve to be content in your life, hands down.
I think you're right. We talk a lot about the first responders, and through, when I was the president of Worldwide Peers Report, we had a family network, and sometimes we don't forget about the families. The glaring problems, that first responder, whether they're an alcoholic or an addict or they're suicidal or depression, but there's these people that loved that person, see them go downhill, and they couldn't do anything about it. And I think, when you do family therapy, is that what you said?
Couples, yeah, okay. Not family per se. Every once in a while, but that it's really hard to wrangle everybody together.
Sure. Well, I tell you what I've learned from my own situation. When you got a family that's willing, first of all, willing to go through it too. That allows that first responder to have a better foundation when coming home from treatment or when coming home from the job. If they got a understanding, hey, when I come home for an hour, just let me be me for an hour and don't jump on me and tell me all the problems that's going on, and just just let me have some breathing room.
Yes.
And the same thing for the family member, but that first responder, when I come home, when I get my breathing word, I need to listen and see what her needs are, or what's going on with the world when I'm gone, and what needs to be fixed around the house, and better communication, and sharing my emotions about my job. I used to think I was protecting her by not telling her about I did CPR on a little baby, or this happened or whatever. But now I just share in a general way. I'm off the job now, but when it comes to something else, I can share in a general way with her. So I think it goes both ways. I know the family members need understanding, but I see them with the understanding. I've been with 5 years. I've been taking all this, not so-called abuse, but verbal abuse, which is bad. And sure. I've been, I fix the meals. I do this. I do that. It's like, I seen the other side. That's why I'm glad there's therapists out there, because that's where I guide family members to, therapists or to other family members, because it's tough. They're very emotional and very sensitive because they've been through a lot themselves too.
You bet. I mean, it's tough both ways. And again, it's going back to what were your initial expectations when you first got into the relationship, sure, or when you first got married, right? It's going back and trying to realistically unwind things and simplify things, because I think that's where a lot of them get into trouble, is things become too complex and it's too many things. And I swear, Skip, every one of my clients right now is coming in with, a laundry list of it's this and it's that and it's this and it's that and it's these people and it's that person and it's this situation. Yeah. And I'm like, okay, so what do we start with first? What's the first top concern here? At least numbers 1 and 2. What are your goals for therapy? How can we get you there as quickly as possible, but really with some depth so that I'm not superficially skimming through this, and neither are you, because, there's some of the first responders that I get them back to their childhood history and then go, oh, well, I had a great childhood usually. And that's funny. If I hear anybody say that I had a great childhood, I'm going, yeah, just wait. Just wait till we start plucking through this. I think you're going to change that statement, because I think that's been a blanket statement because you don't want to go there because you had a painful childhood. Most of us did.
Sure. Well, I tell you what, I'm going to spin this around real quick. Here you're sitting in the office day after day, year after year. You're hearing these horrendous stories from first responders or their family. What do you do for you? What do you do for your good health, your good mental health? What's some of the things when the doctor goes home? What do you do?
Music. I've been in and out of bands since I was 16 years old. I've got a band now called Over the Edge, and my guitarist came up with that one. I didn't, but
I like that.
And he's something else. Yeah. Yeah. Right. It's pretty funny, but, I'm a lead singer and harmonies and some percussion, getting back to keyboards a little bit, but, I love music. I absolutely love it. So music is my first go-to. I sing in the car and sing at home, and what else? I want to go back to roller skating. I started that back up a couple of years ago, and then I just didn't have time to continue it because I like going and doing it at like roller rinks, believe it or not. I grew up in Wisconsin, and in the winter, that's all we had to do was either roller skating or snowmobiling or something like that. But, so I love that. I love roller coasters. So, I am planning to have a, roller coaster day coming up at Six Flags. So cool. This is the whole thing, Skip. You can't do over adulting, and I think we forget that. Sure. It's like you need to have those kid things left in your life so that you can go back and feel carefree, at least for a few moments.
I agree with you. I remember roller skating years ago. We'd have the races, and then you go so fast you couldn't get stopped because there's a wall. You had to drop down and fall before you hit the wall.
Right? Or roller derby time.
Yeah, that's right. Well, doctor, I tell you what, there is somebody listening right now. It could be a police officer sitting in the car at midnight doing paperwork, or it could be a firefighter that just got done with a run, or emergency room person that's cleaning up and that's listening to this podcast, or somebody that's on a mission overseas or that's been retired. They're suffering. They're hurting.
Yeah.
They don't know what to do. You got 30 seconds to speak to their heart. Go.
Okay. And this is what we've done before. It's the sentence of that's really significant. Liberated in yourself, you are free everywhere. I want to recommend that if you are hurting, you are suffering, be honest with yourself first, because it is within you. You give so much of yourself that you need to be given back to. If you need some assistance, reach out. If you need some assistance from me, my phone number is 562-209-1837. And again, my name is Dr. Julie Ann Goode, Goode. Please contact us anytime. We are here to help because you do not have to be in this struggle alone. There are people who get you, and you need to be heard. You need to take some time for yourself, and you need to feel important enough for you to keep on going on, because you need to care about yourself too. You're also in the picture. You are the number one, okay?
That's good. Doctor, I want to thank you for coming on the show again and being you. You're an amazing person. I know where your heart is for first responders and for people in general. And we'd like to thank everybody that's tuned in and listened to us. And just remind everybody, when you go home tonight, shut your phone off, shut your radio off, and get some sleep. Thank you.